Good evening, everyone. Welcome to our Alameda County Budget Forum. I'll go over some logistics first before I do an official welcome and introduction. So we do have interpretation based on the requests that we received. So we're doing interpretation in Korean and Spanish, and you can navigate to it by clicking on the globe icon in the bottom toolbar and selecting a language. And the interpretation instructions are also in the chat. Secondly, we will be recording this webinar so that we can share the recording and the slides with everyone who registered, as well as post it online. And I'll make sure that we also put the link to where you can find the April materials. In terms of questions, please put your questions in the Q&A at the bottom toolbar, and my amazing staff will answer your questions in the chat, and there will also be an opportunity at the end of the webinar to address some of your questions live. So again, welcome to our Alameda County Budget Forum. I'm Supervisor Nikki Fortunato Bas. I'm proud to represent the cities of Albany, Berkeley, Emeryville, Piedmont, and portions of Oakland. Together with my staff team and partners, we're advancing a vision for our county that prioritizes community, equity, and opportunity for all. We're very proud to be collaborating and leading efforts with many of you to defend and protect our communities and our safety net services. We all know that supporting the most vulnerable is the basis of a vibrant, safe, and engaged Alameda County for all of us. And again, in April, we held a budget forum that provided an overview about what comprises the county's budget and the so-called maintenance of effort budget for key county departments. You can find that recording on my YouTube channel, and we will make sure that you all have access to that link. So for today, we are going to share the current status of the county budget. Since April, the county has published a proposed balanced budget, and today's webinar will provide an overview of the Alameda County budget for July 2026 through June 2027, which is our next fiscal year. I'll also share my budget priorities and how to get involved in our budget process. And we're also going to hear from several of our community partner organizations. We are going to learn about the important work they do, what challenges they face, and how the county can partner to strengthen our safety net. So we hope you'll walk away from today's webinar with a greater understanding of what the county budget supports, our budget process, and how you can get involved. So let's go to the next slide and review our agenda. So we are going to hear background on the county budget first. From there, we are going to do an overview of the proposed budget. And then we're going to hear our policy priorities. And I'm really happy to have a number of partners on to join us to speak to healthcare, food security, Care First, Jails Last, as well as immigrant justice. From there, we'll talk about the budget process and timeline, and then we'll do questions and answers. So we do have your questions from the registration form, and if you have additional questions, please put your questions in the Q&A at the bottom toolbar, and my staff will help answer your questions in the chat or Q&A, and there'll also be an opportunity at the end to address some of your questions live. So let's talk about Alameda County's budget. So our county budget is important because it funds our safety net. And our safety net and the county's work is divided into 4 core service areas. These include healthcare. This is services provided by community clinics and public hospitals. Here in Alameda County, our public hospitals are run by Alameda Health System. It also includes behavioral health, public health, and homelessness services. We also provide public assistance, and this is to support safety net programs and benefits like CalFresh and general assistance. And we provide public protection. This includes law enforcement, including in our unincorporated cities, our probation department, public defender, district attorney, and our courts. And then we also administer general government, and this is for the county to operate and provide municipal services for residents in our unincorporated cities. And again, you can watch our April budget town hall to hear more specifics about those budgets. Next slide. So the budget is probably one of the most important decisions the Board of Supervisors will make. And hopefully you have heard that Alameda County is heavily reliant on state and federal government funds for our programs and services. A large portion of the county's revenue comes from the state and federal government, so the county serves as the local provider and administrator of many state and federal funded safety net services. These include programs like Medi-Cal for healthcare, CalFresh for food assistance, behavioral health, housing and homelessness programs, and public safety programs. And 58% of our general fund budget for the next fiscal year will come from state and federal sources. This is actually lower than past years, and that's due to increased local sales tax revenue like Measure W, which is a bigger part of our budget going forward. Next slide. So HR 1 has made dramatic cuts to our social safety net. Because Alameda County relies heavily on state and federal aid, it's highly sensitive to state and federal policy decisions and budget cuts. And one of the most significant policy and budget changes in our generation is HR 1. This is the federal budget bill signed by Trump on July 4th of last year. So you will see from this graph that over the next 10 years, the richest 1% will get over $1 trillion in tax breaks, while the most vulnerable members of our community will lose access to health care and food assistance. In my opinion, this is an obscene corporate giveaway. It's a massive transfer of wealth from working people who rely on Medicaid and Medi-Cal for health care to greedy billionaires seeking more tax breaks. And I do hope that over time, our state in particular will be able to ensure that everyone pays their fair share and that we are actually addressing some of the inequities in our tax structure. Next slide. So the goals of HR 1 and this current federal administration is to dismantle the safety net and shift federal safety net costs to our counties and to our states. So HR 1 establishes new work and community engagement requirements for CalFresh and Medi-Cal recipients. It also creates more administrative hurdles with eligibility changes that require people to re-enroll every 6 months rather than every year. So nearly 160,000 Alameda County residents will be subject to the work requirements and could lose health coverage. Nearly 40,000 CalFresh recipients may lose their food benefits. And if you have questions about Medi-Cal and CalFresh, including your coverage or your re-enrollment, please go to the websites that you see here, healthyac.org for Medi-Cal and benefitscal.com for CalFresh. And immigrants are especially vulnerable due to changes in federal definitions of qualified immigrants who are eligible for these benefits. Now, this is an unfunded mandate. County staff will need to implement the new work requirements and determine eligibility, which will increase their workload. And currently, there's no additional federal or state funding for county staff to meet this increased workload. We are also anticipating that federal program changes, including to the Section 8 program and to HUD's homelessness funding, will impact funding for those services here at Alameda County. So as you can hear, these are very, very serious impacts. Next slide. So at the state level, we're also seeing some impacts. In the current budget, the state instituted a Medi-Cal enrollment freeze on individuals with, quote, unsatisfactory immigration status, or UIS, unquote, including many undocumented immigrants. So in Alameda County, almost 50,000 residents with unsatisfactory immigration status are enrolled in Medi-Cal, which means that if they lose their healthcare coverage, they won't be able to sign up for Medi-Cal again. So we have since last year been doing a lot of proactive outreach with our community partners to help keep people insured. Also in California, Proposition 1 shifts the state's Mental Health Services Act to the new Behavioral Health Services Act, changing how funding can be used. And the greatest impact is on prevention and early intervention programs. And these particular programs are often low barrier and culturally responsive, helping residents meet their needs before it becomes a crisis. Now, the governor's so-called May revise budget also cuts funding for safety net services. This includes introducing a new asset limit for Medi-Cal recipients, eliminating payment rates for federally qualified health centers for services provided to immigrants, and shifting portions of in-home supported services and mobile crisis response, shifting a portion of those costs to counties starting next year. The May revised budget also reduces the state's investment in homelessness by half in a particular program called HAP. So the state is still finalizing its budget, and some of these changes may not included. We'll have more certainty when the state budget is passed next week. Next slide. So what does this mean for Alameda County? Attacks on our safety net will hit the most vulnerable residents the hardest. We are going to see increased food insecurity as residents lose access to CalFresh, and as people lose healthcare coverage, they delay care, leading to more preventable emergencies and increased reliance on emergency rooms. And at the same time, our healthcare system will face growing financial strain. So that means our public hospitals and community clinics serving low-income residents will see rising uncompensated care as coverage declines. And Alameda Health System, our public hospital system, is projecting a $100 million deficit next fiscal year. Meanwhile, our federally qualified health centers are also facing higher cost and reduced revenue. And counties have a mandate to provide what's called indigent health care to people who are low-income residents or who lose their healthcare coverage, their Medi-Cal coverage. This is through a program called Health PAC. And with increased demand for Health PAC, that means that more of the county general fund may have to go towards shoring up healthcare access for the most vulnerable. Next slide. So I know that has been a lot of information. It's very, very serious. My priority, together with my staff team, is to ensure that we maintain our safety net amidst these federal and state budget cuts and policy changes. And I really want to thank our community members, our community organizations, all of our partners, because thanks to our advocacy, there are already investments the county is making in this year's budget as well as our proposed budget. So this includes housing. I believe housing is a human right. So we've allocated $116 million to date from the Home Together Fund of Measure W, and an additional $288 million is budgeted for the next fiscal year. And Measure W, again, is the half-cent sales tax that we collect. So this funding has brought 300 new shelter beds online, and we're investing in 950 new affordable housing units, including units set aside for people who've been experiencing homelessness. We're also investing in tenant protections, such as rental registries and proactive rental inspections in the unincorporated cities. And food security is also something that's very important to us, and you'll hear more about food security in a few minutes. We secured $50.5 million over 3 years for food security so that we can make sure people have the basics of food access. In terms of healthcare, the board recently approved $37 million in Prop 1 behavioral health bridge funding. So providers, including prevention and early intervention providers, will have an additional year to transition their services. We also increased our allocation to Health PAC, which supports community clinics and Alameda Health System to provide health care to the indigent. And as some of you know, I chair our Alameda County Together for All, or Act for All committee, which is focused on looking at the impacts of the federal administration on our most vulnerable residents. And so through those public hearings, I'm glad to say that we've advocated together, and our budget includes funding for organizations and programs serving immigrants and refugees, the LGBTQ community, and seniors. For many of these items, funding is coming from Measure W's Essential County Services Fund. And though the board has given direction on many of these important services, the funding allocations will be finalized when the board formally adopts our budget at the end of the month. So I hope that framing was helpful. And now we're going to dig into the proposed county budget for next fiscal year. And I'd like to introduce Agnes Cho, who is our District 5 Senior Policy Analyst. Thanks, Agnes.
Thank you, Supervisor. Hello, everyone. Thank you for spending your evening with us to learn more about the county budgets. My name is Agnes Cho. I work as a Senior Policy Analyst on housing, homelessness, and healthcare, and have been kind of shepherding our budget work. And be providing a very brief overview of the county's budget. It is a tremendously large budget, and this is intended to be a high-level summary. And you can find more information about the budget on the county's budget website, budget.alamedacountyca.gov. And we'll share that link when we share these slides in the recording. What is in the budget for this next fiscal year, which runs from July 1st, 2026 to June 30th, 2027? The county's total budget is $6.7 billion. That's about a 9% increase of $570 million from last year, and that's largely driven by additional revenue from Measure W, the half-cent general sales tax. And the general fund of that 6.7 billion, the general fund, which is the main operating fund that the board has more discretion over and that supports core services that we rely on every day, is about $4.3 billion. This is a slide that shows kind of the appropriation, the budgets by the four core service areas that the supervisor mentioned earlier. The four core service areas are healthcare services, public protection, public assistance, and general government. You'll see that healthcare has the largest budget with about $1.3 billion, followed by public protection and public assistance, which each make up about a quarter of the county's budget. And now we're going to look at the budgets for each of these service areas and kind of key investments that the county makes. So first, starting off with healthcare. The agency that implements our healthcare services is Alameda County Health. There are four kind of departments within Alameda County Health, or AC Health. There's the Office of the Agency Director, which administers kind of all of our homelessness investments, among other investments, behavioral health, public health, and environmental health. It has the largest budget of any kind of department with $1.33 billion for the next fiscal year. And the key investments include over $800 million of mental health appropriations for services dedicated for people with serious mental illness and substance use disorder. It also includes $288 million in Measure W Home Together Fund to really implement our investment in homelessness solutions. We also have in this budget $139 million in direct contracts with our public hospitals, Alameda Health System, or AHS for short. This is in addition to the $144 million that's not reflected in the general fund that Alameda Health Systems receives directly from a Measure A sales tax, so another sales tax that the residents of Alameda County pays that goes directly to the hospital. And finally, we have in here $73 million this next year to support Health Pack, which is the program to support healthcare access for indigent residents, low-income residents who are uninsured. The next core service area is public assistance. This is largely administered by the Social Services Agency, and the goal of the Social Services Agency is to provide essential supports and benefits for people who kind of need to meet their basic needs in times of challenging times. Some of the key investments that SSA, the Social Services Agency, makes is the in-home supportive services, IHSS. This supports nearly 24,400 Medi-Cal recipients who receive IHSS supports who are elderly and have a disability, so they can receive care in their home. SSA, with their budget, also administers several benefits programs, including CalWorks, General Assistance, and CalFresh, and we'll learn more about CalFresh kind of later on in this webinar. SSA also has funding set aside for adult protective services, which responds to abuse, neglect, and exploitation of elders, and emergency child abuse services to prevent and address child abuse. The next core service area is public protection. The public protection budget includes funding for the sheriff's office, our probation department, our district attorney, public defender, and trial courts. One of the largest departments in the county and within public protection is the sheriff's office, which has a budget of nearly $650 million. And a key part of why that is so large is because it includes a $386 million budget to run the Santa Rita Jail. Other investments kind of in our public protection budget includes community contracts with from AB 109, that is state funding that is operated through the probation department for services for people on probation. And it also funds programs like the Public Defender's Clean Slate program and kind of the various collaborative courts that we have in the county. And finally, the fourth core service area is general government. So these are the departments that keep our county running, from collecting taxes to administering elections. Hope y'all voted last week. It also provides municipal services for the people living in the unincorporated county, where it kind of acts as their city of sorts. Key investments in general government include housing and community development. The HCD, Housing Community Development Department, is under general government, and they administer the Measure A1 housing bond, which invests in the development of new affordable housing. They also administer $29 million next year in housing and community development grants. And the budget includes $7 million for staffing and services in our community libraries, as well as kind of all of these other services for unincorporated residents and for the county at large. The county cannot do this work without the incredible community organizations. This next fiscal year, we expect to have about $1 billion in contracts with 269 community-based organizations. Kind of, you'll see that some of the departments that have the most a number of contracts with CBOs are Alameda County Health. And kind of the budget, the $983 million set aside for CBOs, that we contract with CBOs, includes for many a 4% cost of living adjustment for CBOs. And if you want to dig deeper into kind of who are the organizations that the county contracts with, I really recommend that you look online on our budget, on the county's budget website. They publish a full list of the organization that the county contracts with, what they contract for, and the contract amount. And you can find that on the budget website. And this year, kind of, we are really reckoning with the challenges to the budget with the federal and state government kind of budget and policy decisions that the supervisor mentioned earlier. Partly due to that, the county had to reckon with a $91 million funding gap. Thanks to the county administrator's office and all of the departments through the MOE budget process, the maintenance of effort budget process, they were able to find kind of ongoing and one-time strategies to close this $91 million budget gap without resorting to layoffs or program reductions. This is a really incredible feat, and some of the strategies that they used to close this budget gap included reducing 45 vacant positions and literally looking for all of the departments to find ways to reduce their expenses and looking for new revenue, including kind of one-time trust funds. Um, Many of the policy and budget challenges that we discussed earlier in this webinar really are going to go into full effect next fiscal year. They start kind of in calendar year 2027 and they run into next year and they kind of waterfall and we're gonna really be feeling these effects next year. So we anticipate kind of really tough budget decisions to come up next year as well. And just as providers of these essential safety net services, the county's ability to maintain a balanced budget not only is required of state law, but it's really critical so we can continue to provide the services that many of our vulnerable residents rely on. So I'll invite the supervisor back on to kind of lead us on our next part of the agenda.
Great, thank you, Agnes. So our office is really proud to collaborate and partner with our community. Tonight, we are joined by several community organizations who are working to provide safety net services and advocate for a more resilient Alameda County. We'll share more about what our office is working on and four policy areas, including healthcare, Care First Jails Last, food security, and immigrant justice. And we're going to hear from our community partners about their work, their needs, and opportunities for advocacy. So we'll go into Healthcare for All first, and I'll ask Agnes to join us again to do this introduction.
Thank you, Supervisor. So one of the core values that's driving our work is that healthcare is a human right. And as the supervisor mentioned, we're really seeing significant impacts to healthcare access and healthcare providers due to HR1 and the state budget. This really is impacting our community clinics or our federally qualified health centers who are going to be seeing increased uncompensated care as more people lose healthcare coverage and the state eliminates insurance coverage and service payments for immigrants. And we're also seeing financial strains on our public hospital, on Alameda Health System. They are facing $100 million in budget deficit, partly due to revenue shortfalls due to kind of state and federal policy changes. Well, the county is really responsible for providing safety net healthcare services, and we really cannot do that without our community providers. And we're working, our office and the entire Board of Supervisors and the county, we're working really closely with these core partners. So with Alameda Health System, we're finding ways that we can address their short-term budget deficit while preserving patient care. And we're also in close conversation with our federally qualified health clinics, one of whom you'll hear from shortly. These clinics are really responsible for serving anyone who walks through their doors, including those who are underinsured or uninsured. The supervisor mentioned this earlier, but we are investing in healthcare, making additional investments in healthcare. We committed an additional $3 million for Health Pack, which provides support for the clinics and for hospitals that are serving the indigent. And there's $3 million committed this year and $15 million allocated the following year. And we have additional funding from Alameda County Health and SSA, so the Social Services Agency, to make grants to community organizations who have spent decades kind of building trust and building relationships to conduct outreach so that people can stay enrolled in Medi-Cal. And one of these trusted community partners is Asian Health Services. So it is my great pleasure to invite Julia Liao, the CEO of Asian Health Services, and Tu Quach, the president of Asian Health Services. So Julia and Tu, I'll turn it over to you.
Great. Thank you so much, Agnes, and thank you to Supervisor Bass and for your leadership in the county for this opportunity to present. We can go to the next slide. Just a little bit about Asian Health Services. We were founded in 1974. We were a part of the activism really around providing healthcare, affordable healthcare services. And we saw that the two factors for affordable healthcare were really around language and affordability. So our dual mission is really around service and advocacy for the underserved. We provide mental and dental and medical healthcare services to nearly 50,000 patients, of which the majority are Medi-Cal, Medicare, and Medi-Medi. We also have cultural competency with 14 languages, of which 12 are Asian languages. So we have folks from all over Alameda County who come to our clinic and even from Contra Costa as well. And just to note that we have about over a third of our patients are limited English speaking, and that over 38% are of their senior age as well. We'll go to the next slide. Just to share a little bit about the impacts, you heard a little bit earlier about HR1. So how's that going to affect us? Well, we're going to have about 7,000 of our patients who could be impacted due to, again, all of the changes at the federal level from HR1 and also at the state level. There's also a California ballot initiative that is focused on federally qualified health centers like Asian Health Services, and that loss is about $9 million per year. At the same time, there's also the Medi-Cal restrictions and reductions. Again, you heard about redetermination, the work requirements as well. So both of this, we will lose up to $6 million a year because we see that a lot of our adult patients will no longer be eligible for Medi-Cal because of work requirements, and the estimate is that 72 to 80% are expected to fall off of Medi-Cal. And there's still some factors that are pending that are coming down the line. There's public charge. We know that that is going to be coming back around again. That has caused a lot of chilling effects for patients to come to our clinic. And then also there's also the federal public benefit enforcement. We're still awaiting. We haven't heard anything, but that's also still looming as well. Next slide. And so this really, I know this is quite a lot here, but I think that we have identified all of these different risks. One thing also that has recently come up is around a fiscal cliff for our reimbursement mechanism, especially for UIS. And so we also estimate quite a large loss from that because we do get a certain reimbursement through the state. So all of this, we are looking to respond in a way that protects and defends our care and services. We want to strengthen and invest, but also build infrastructure for better outcomes. There are incredible gaps ahead, but we also want to be part of the solution and really sort of investing in a lot of partnerships so that we could build what is going to have to be a stronger ecosystem of safety net care. I'm going to go to the next slide. I'm going to turn it over to Tu for the next couple slides.
Thanks, Julia. So as Julia mentioned, there's a lot that's at stake for us. And so the first budget priority for us is just to be able to be stable, to be there as people lose coverage, to be there to ensure that we can still provide them with the health care that they need. That is so critical as you see so many people fall off and that we're not going to get reimbursed for a lot of the care that we have. So we really need to, just because someone loses their insurance doesn't mean they stop being our patient, and we believe in that very strongly. So we need to make sure that our safety net care and services are stable. At the same time, we need to work with our community to make sure that patients get enrolled and renew in Medi-Cal. As you know, that with the 6-month renewal, that's going to cause more burden on patients and others assisting them to make sure that they don't lose their coverage. We also need to increase the likelihood that patients stay connected with the benefits that they have, whether it's with SNAP and the food benefits, as well as with Medi-Cal. And then with this work requirement that requires people demonstrate that they are working or volunteering or taking classes, it's going to take a lot of work. And with the vast majority of our patients being limited English proficient and facing a digital divide, we need to make sure that they are not left out. So that means that there's going to be more work for our staff and for those who we partner with. And we want to support the continuum of patients. At Asian Health Services, we care for folks before they're born, when they're in the stomach, when they're in perinatal stage to end of life. With our elderly being 38% of our patient population. And in comparison, many federally qualified health centers have about 10%. So we actually have a lot of elderly patients that we care for, as well as their families and such. And as the supervisor mentioned, that this July, the Prop 1 transition takes place. And with that, a lot of the prevention funds will go back to the state. And so the county is shifting us to early intervention. It's important, but it also means that we can't use a lot of the mechanisms that we use to meet people where they're at. So we have to still continue to do that, but it will be unfunded in many cases for us. Next slide. But there are always opportunities for us to collaborate, particularly with the county. So as we work with the county, we want to advocate for data transparency and access. This is really important as we reach out to folks to make sure that they meet the enrollment and re-enrollment, as well as the work requirement. We need to align on our messaging and materials for the communities around renewal process and eligibility. We want to partner with different organizations, maybe outside of health, to make sure that they can assist us to do these massive enrollments and re-enrollments, as well as meeting work requirement. And as we look at all of this work, it's important to always pay attention to language access, to mental health, whether they're diagnosed or not diagnosed, as well as to data disaggregation, because we know that many times a lot of the disparities are hidden in some of the communities that you don't see unless you disaggregate. Next slide. For Asian Health Services, we've been working and very proud to be part of Alameda County, but we know that a lot of the challenges that we face are not unique to this county. So in 2022, we have started a statewide health equity coalition with organizations that serve Asian American, Native Hawaiians, and Pacific Islanders. And we have 44 organizational members, 15 individual contributors, and 18 affiliated partners. And we've been really pushing on issues, whether it's during COVID or whether during these times as you have policy changes, the impact, and really looking at issues around language access, data disaggregation, and mental health. And we will continue to look towards a health equity lens as we approach these issues. Next slide. Julie, did you want to close out with anything?
No, we just really want to thank again Supervisor Bass and the team for having us today. And, we know that we can be working together and look forward to the opportunities to partner on solutions as we face historical challenges ahead. Thank you.
Thank you so much, Julia, and to Asian Health Services and so many of our community clinics, our public hospital systems. I've had a chance over the past few weeks to speak directly to healthcare workers who are on the front lines, and there are some real challenges that we're facing to make sure that people have access to care, that they stay healthy, and that we're not sort of exacerbating any healthcare issues or any patient care issues through this crisis. So it's been really good for our office to learn from folks on the ground, like the both of you and your organization and your coalitions, and to take that information and to advocate. And so we have been spending quite a bit of time at the Board of Supervisors in our committee meetings, as well as our budget work sessions and meetings, really addressing how we're proactive to do the necessary outreach, to make sure people know what resources to access, and to prevent as much harm as possible from these federal and state changes that you are hearing about. And the advocacy will continue. I do want to note that we have a staff person from Senator Arreguín who is joining us on this webinar. So, let's keep fighting for as much as we can get from our state budget to help us through this crisis. And then we also have some elected officials from Berkeley and Albany and staff from elected officials in Oakland. So appreciate everyone who's joining. Okay, so next we are going to talk about Care First, Jails Last. If we could go to the next slide, thank you. So Care First, Jails Last is a policy resolution that the Board of Supervisors passed in 2021. And the aim is to divert people with serious mental illness and substance use disorders from the jail system and connect them with community-based care. So it recognizes that many of the challenges that bring people into contact with the criminal legal system, mental health crisis, substance use disorders, homelessness, poverty, trauma, cannot be solved through incarceration. And the Board of Supervisors has repeatedly affirmed its commitment to Care First, Jails Last as a guiding framework for county policy and investment. Advancing these policies and investments requires collaboration between multiple county agencies, including behavioral health, sheriff, probation, district attorney, public defender, and housing and homelessness. And there's been very robust community organizing and advocacy around these principles. I personally really appreciate everyone who is doing this organizing and advocacy. We have to continue working to make sure that we can implement this resolution and make those changes real. And you will hear from this presentation that it's so much smarter and more effective to invest in care first versus incarceration. So I want to introduce and invite Kari Melke from Restore Oakland to share a little bit about the work that they are doing.
Thank you so much, Supervisor Bas. I'm so grateful to be here. And I just want to say thank you to this amazing audience for being here on this gorgeous afternoon, evening. Yes, I'm Kari. I use any pronouns. I'm with Restore Oakland and the Care First Community Coalition. I am a social worker, community organizer, a Black queer person, and someone who's been supporting my loved ones through mental health crisis and incarceration for many years, which is what keeps my heart in this work. And the Care First Community Coalition is a grassroots group of individuals and orgs who are committed to shifting resources away from Santa Rita Jail and the Sheriff's Office into life-affirming care, housing, and community resources that folks impacted by criminalization, mental illness, and substance use issues actually need. And I think that we are all aware, I assume, that in Alameda County, those folks at that intersection are disproportionately Black, poor, and based in Oakland. So that's just also where we ground a lot of our work. And yes, you can go to the next slide. So because this is a budget forum, I wanted to start the presentation with a slide that compares costs. So these are costs of average of services, I'll put in quotation marks, that might be applied to people at that intersection of justice involvement and behavioral health issues. And as you can see, the cost of incarcerating somebody in our county is monstrous. This is actually a bit outdated, but we are spending over $250,000 a year incarcerating folks, and we are foregoing the opportunity to support people with deep, holistic wraparound care. So at the bottom of this graph, you can see 3 different things that are really high intense interventions that people will often say and elected officials will often say are too expensive to fund for our most vulnerable folks, but are extremely affordable in comparison to incarceration. This is to be specific. For example, permanent supportive housing costs $100,000 less than, that means giving people a house and wraparound care costs less than having them in the jail. So we know there are upfront costs, we know there are logistical barriers, but we have to dispel the myth that it's too expensive to care holistically for our folks with the highest need. And we know that when we do provide that care and housing for all, our communities get safer and healthier, and that allows for additional cost savings in the long term. So we ground in Care First as a fiscally responsible policy, but it is also an effective human-centered policy that is rooted in racial, disability, and economic justice. And it's more than a fiscal responsibility as well. So yeah, if you go to the next slide. I do want to take a moment of silence to honor the 78 people who have died in Santa Rita Jail since 2014. And just in these last 3 months, the 3 folks that we've lost who are in their 30s and 40s who died senselessly, may Brandon Anthony Joseph Watson, Kenyona Farr, and Jeffrey McMaster rest in peace, rest in power. I think that we can all agree that morally we can't continue pouring community resources into cages where our loved ones die. And we know, and I'm going to show you all a bit more about what we want instead. This is something that we are always going to keep fighting for. Every jail death is too many. And so I will say this also, no matter what, whether people were there pre-trial or not, people don't deserve to die in jail, but the vast majority, over 90% of people in Santa Rita Jail are there pre-trial. So they are actually not convicted of a crime and are there awaiting their trials. So they could be at home being safe. Okay, yes. So what do we want instead? Yeah, as you all saw on Agnes's slide, in this era of budget crises and shortfalls, the sheriff's office is still one of the largest and most well-funded offices in the county, with a budget of over 600 million, over 300 million going to Santa Rita Jail, and that is wasting invaluable resources, not only because it is a death trap, but also because it has been half empty for many years. So Care First Jails Last is a policy that's based on the belief that the bloated budgets for our jails and sheriffs must be reallocated. And we have actually done a lot of the legwork for our electeds and our community members to see where in the county's budget we can actually reallocate some of the funds in strategic and less negatively impactful ways. So we see that in the county's sheriff's department budget, I'm sorry, can you go back for 1 moment? Thank you. There are hundreds, at least tens of millions of dollars that are currently allocated for jail staff that are vacant positions. So that is not actually paying staff members that are there, and that are also sitting. We actually don't know where they are, but we stopped a jail expansion several years ago, and that was a $26 million expansion from county funds that we believe must, now that it was not used, thank goodness, for a jail expansion, that must be liberated and shifted towards the community-based mental health care that we all need. So to be more specific, we have 3 primary budget demands this year, and they are very wonky. They are technical policies, so I'm going to go into them a little bit, but to be brief, we want folks to know a little bit about the interventions that we're so incredibly excited about and we know that the community needs. So we want $2 million for board and care homes, that particularly the Supportive Housing Community Land Alliance is building and developing for our most vulnerable folks with serious mental health and substance use issues, who are also often at the intersection of justice involvement. And we also, I want to highlight that the SHCLA is a land trust model. So that is a space where folks are getting, where that organization is getting properties that become permanently affordable, creating assets that live on in our county and with people who need them the most, rather than being continuously on the speculative real estate market. We are gonna continue fighting for $5 million to staff our county's mental health diversion court, and I'll talk more about that in a second. And we are also fighting for a big whopping $125 million per year for deep housing rental subsidies that would go to folks that are most vulnerable in terms of homelessness and mental health crises and criminalization. So that is, yeah, it's a big ask, and I'll talk a little bit more about it, but let's keep going. So as folks can understand, if we want to achieve a county where Care First is possible, where we actually don't need to invest hundreds of millions of dollars in a jail and in policing, we need funding for housing, with holistic supports, healthcare, and spaces for people to actually heal and build together. So that is what we see licensed boarding cares can be. They are a life-saving and cost-efficient intervention. They are small-scale housing spaces that are for folks with the highest acuity needs, mental health, developmental, physical disabilities, and they provide 24-hour supervision, support, and community care. And when they are done well, these can be joyful and beautiful community-based settings for folks who are really, if not in that space, or if not cared for by family members, which oftentimes families do not have the resources and capacity to care for their loved ones, even if they want to. If not, they are most likely ending up either on the streets or in jails, or in psych hospitals and institutions, which are, as we saw, much more expensive and also much more harmful. So SHCLA, or the Supportive Housing Community Land Alliance, is fighting to open a gorgeous building in West Oakland that I actually got to tour last month called the Union. And it is a licensed boarding care that can be providing holistic support and housing for transitional age youth who are extremely vulnerable to both criminalization and homelessness. So we are fighting for that in this budget, and we love the Supportive Housing Community Land Alliance. Next, we are fighting for this mental health diversion court staffing. We know that people don't understand a lot about our court system, and that diversion courts can be kind of a black box of confusion. Mental health diversion court is a state mandated court. So California has decided that counties need a mental health diversion court, and it is designed to get folks with serious behavioral health needs out of jail and into community-based treatment, and to support them to be healthier and in recovery, and to be able to have productive and socially connected lives. So we know that this is a care first intervention. And we also see that in this mental health diversion court that we currently have, we have 400 clients in that court and no assigned social workers that are in the court system. So folks are kind of getting willy-nilly placed as they can, and our community-based organizations are working overtime to help those folks. But we have seen that in other counties, the courts with social workers and designated public defense attorneys inside of that mental health diversion court are incredibly effective. And this is an intervention that has the opportunity to save so many lives and to get folks sorry. I'm just seeing the chat. I will move us along. We need mental health diversion court staff funding. And we have a place where you can endorse the budget demands. And you can also, so if you scan this QR code, you can join over 160 folks who have endorsed the demands and 35 organizations. And also we can save the date, the next slide, to mobilize on June 18th for an art build and a mobilization to support these demands. Thank you.
Thank you so much, Kari. Really appreciate your work at Restore Oakland, as well as the Care First Jails Last Coalition. There'll be updates by our Mental Health Advisory Board and our Public Protection Committee later this month and into July. So there's more that people can plug into, including really important advocacy on the budget. The board did recently approve $900,000 for the land trusts. And it's really, really important for folks to make their voices heard, to advocate with all of the members of the board so that we can move forward with these really smart budget allocations. We've got two more folks that we want to introduce to you who are doing incredible work. So next we're going to talk about food security, and I am happy to introduce and invite up Aliza Cosme, who is our District 5 Director of Community Partnerships.
Thank you, Supervisor, and thanks everybody for being here. So I am really excited to hand it in a couple of minutes to Monique Brown, who's the Executive Director at Mandela Partners. And Monique is one of our partners that's part of our Food Sovereignty Roundtable. It's a county-wide coalition, which includes county administrative staff, folks from both the unincorporated area and almost every city, organizations within and outside of the ACCFB partner network. And really what we're aligning on, including these values, is that we understand that while we have many pantries, the pantry system alone cannot solve the hunger crisis, and we need and want to build food sovereignty, which requires doing things differently and really synergizing our tactics, advocating for greater investments in our local food system, and helping folks retain CalFresh. So if you want to get involved, feel free to check out that bit.ly. And then on the next slide, we have various victories. I am not going to go into all of them, but you can read the slide later. I do want to highlight that we have really been strengthening our partnerships across the public and private sectors, across government and non-government, and that relationship building is just priceless. Including the coalition's budget advocacy, which has really helped the supervisor champion food security and investments by the county. Historic investments, which really recognize the full hyper-local food system. So deep appreciation and congratulations to all of the CBO partners who've been a part of that. And I know there's a lot, but moving ahead for the sake of time to the next slide. So we're really dealing with a trifecta of the skyrocketing cost of living, the different federal budget and policy changes that folks have started to mention, and the illegal war on Iran impacting the global food supply chain. And specifically with those federal policy impacts, we're looking at 3,700 non-citizens in our county losing CalFresh completely, and then another 23,000 folks at risk of losing CalFresh unless they can fulfill work requirements. The CalFresh work requirements actually are in effect, and they're going to start for different people depending on when their next CalFresh renewal is. So please consider getting involved and learning more about these requirements. We're going to be following up with resources that we'll be sharing on social media, including tomorrow, and email. And with that, I'm just so honored and looking forward to continuing to work with Monique and many others through this county food sovereignty roundtable. And I will go ahead and hand it over to Monique.
Thank you, Elisa, and thank you, Supervisor Bas, for this opportunity to speak to you all today. Mandela Partners has been based and rooted in West Oakland for over 20 years, with a goal of building a just and abundant future for communities through food. Agnes, are you showing I can't see. Just want to make sure you're showing the link to our website. Great, thank you. So I'll keep going. Last year, we reached more than 11,000 people across our programs. Some examples of the impact we've had, if you scroll down just a little bit, we've distributed fresh and free produce to nearly 6,000 community residents. And I just want to highlight something that Elisa just said. Through the Alameda County Rapid Response Food Resilience Fund, we were able to immediately mobilize to respond to the needs of families who saw their food budgets cut overnight. We were also able to reach 885 seniors and families through our holistic wellness programming. We sourced fruits and vegetables from our network of 20 sustainable BIPOC farmers. We supported 55 early and mid-stage food entrepreneurs, and we created 16 quality culinary jobs and distributed over $76,000 in culinary training, stipends, and seed funding for entrepreneurs. I meant to mention that some of the work that we do centers around 3 core areas. That includes food entrepreneurship, food access and distribution, and food workforce development. And although we've been able to achieve this level of impact, there is still so much more to do. So many of you remember 2025. It was a really hard year with all the executive orders and all the mandates that changed a lot of funding, specifically for food access programs. Federal and state funding sources that have historically supported food access services like ours, and those of my colleagues working on the front lines in this work, are shrinking and becoming less predictable. Specifically at Mandela Partners, we saw our federal and state funding decrease from 70% to 20% in 1 year, resulting in a $1 million budget deficit, across all of our programs and operations, and I know we're not alone. The need for food remains very high, creating a difficult reality. There's so much more to do at the very moment that funding is being extracted. And we all know that food is a basic human right and must be protected. So our primary priority is sustaining the existing community infrastructure. Organizations like Mandela Partners have spent years building trusted relationships, effective programs, and local partnerships. Many food security organizations have closed their doors due to funding, and once that infrastructure is lost, it is extremely difficult to rebuild. But we are resilient and building a powerful coalition. You also heard Elisa mention the work of the Food Sovereignty Roundtable. And we thank Supervisor Bas and her team, Elisa and others, and Dave for spearheading this roundtable. Our coalition of cross-county partners has asked for continued funding for food security in the amount of $14.8 million. This funding is meant to continue to support and sustain meal preparation for vulnerable Alameda County residents, including seniors, unhoused individuals, and food insecure families. Food procurement, supporting small and medium organizations in establishing food procurement supply chains within the county. Food recovery support and logistics, addressing environmental harm by supporting food recovery efforts, including transportation and materials needed to safely recover and distribute surplus food. And diverse organization support, providing opportunities to organizations operating at the hyper-local community level, using innovative models to ensure neighborhood food security and resilience. I want to thank again all of you for being here. I thank Supervisor Bas for this opportunity to share this critical work being provided in our communities. And I ask that you please stand with us as we continue to stand with you, our county neighbors. Thank you so much.
Thank you, Monique. I really appreciate the work of Mandela Partners. And as we know, neighborhoods like West Oakland are food deserts. And so the work of Mandela Partners and a host of other organizations makes a huge impact on the ground. The need for food is so great. And it's really through our collective advocacy that we've already been able to secure money for the next 2 years, funds for the next 2 years to support the work that Monique talked about. So next we're going to hear about immigrant justice. And I am excited to introduce Cynthia Munoz Ramos on our District 5 team. And she is our Chief of Legislative Affairs and Public Safety. Take it away, Cynthia.
Hi, everyone. Good evening, and thank you so much for your time and spending this evening with us, as well as your advocacy and long-term commitment to Alameda County and our residents. So a little bit to introduce this work around our immigrant rights. I'm going to have the pleasure of introducing Lisa Knox, who is Executive Director for California Collaborative for Immigrant Justice. She also, or California Collaborative for Immigrant Justice, rather, also is one of the key coordinating organizations for ACCORD, Alameda County Coalition for Removal Defense. And we wanted to just do a little bit of introduction. You know, since we came into office last year, we started this Act for All, a committee through which we've been making sure that we are uplifting and talking about the issues impacting our most vulnerable communities, which are the issues we're discussing today as it relates to our budget. In Alameda County, for decades, communities have been advocating for a more just, a more equitable, a more inclusive Alameda County. And in 2015, there were efforts to make Alameda County a welcoming county as folks were making, be louder, as also communities were organizing to ensure that within our jails, people were getting due process and being treated with justice. Communities have long fought for these processes, and in the last 10 years of this administration 1.0 and 2.0, we are seeing a need for once again ensuring that our services at the county are meeting the needs that exist. And so we have 3 incredible coalitions that are doing. I'm sorry, I need to speak louder, and if someone can give me a thumbs up when I sound louder. Do I sound louder yet? No. Okay, well, it is my pleasure to introduce Lisa Knox, who coordinates the work around our deportation defense. Our strategies at the county are deportation defense in community, as well as deportation defense within our public defender's office. And we also additionally have 2 other coalitions that do legal defense in community, deportation defense, that's ACCORD, and ACUDIR, who does organizing to ensure that our communities not only can survive and keep each other safe, but also thrive. And because my sound isn't great, I will just hand it over to Lisa Knox. And thank you all for your time.
All right, thank you so much, Cynthia, for that introduction. I'll try to speak loud, but if anyone can't hear me, let me know. And good afternoon, everyone. Thank you so much for being with us on this beautiful day. You chose to stay inside to hear us speak. Really appreciate that. So I will keep it short, but again, as Cynthia mentioned, I'm Lisa Knox. I'm here representing the California Collaborative for Immigrant Justice, CCIJ for short, and the ACCORD Collaborative. So CCIJ provides legal services and advocacy for immigrants who are currently in or at risk of detention. And here in Alameda County, we're proud to be the backbone of ACCORD, the Alameda County Collaborative for Removal Defense. And ACCORD brings together 8 trusted community organizations that provide legal services, including API Legal Outreach, African Advocacy Network, East Bay Sanctuary Covenant, East Bay Community Law Center, Immigration Institute of the Bay Area, Oasis Legal Services, and Pangea Legal Services. And together we provide direct representation to immigrants fighting their deportation in court, helping them seek asylum, navigate complex legal pathways, and secure release through immigration bonds or family court petitions. And so our model is, rather than forcing vulnerable individuals to find a new door to knock on, we're just building upon partnerships with trusted community organizations. So all of our organizations already have our partnerships and connections. And then we're working closely with ACILEP and ACUDIR so that when a resident is detained in Alameda County, ACILEP's rapid response hotline will provide immediate emergency support and then can hand the case to ACCORD if needed for ongoing legal defense. And meanwhile, as ACUDIR is organizing the community, they're also providing the community with information about our services and referring residents directly to us for services. And since launching last year, we've reached more than 950 Alameda County residents, and we're providing legal services to more than 175 residents every single quarter, and also actively conducting community education sessions, primarily in Spanish, English, and Hmong, but in other languages as requested to ensure that everyone knows their rights. And so, as others have touched on, we're doing this work in an increasingly hostile and chaotic environment. Last year, ICE arrests in Northern California more than tripled, and they continue to increase. And at the same time, as you may have heard in the news, we're seeing the constant weaponization of the immigration courts that has made these cases much more complex to fight and to win. Although we still, when we do fight, we do win. And you may have heard, for example, about the closure of the San Francisco Immigration Court and the forced move of those cases to Concord. And so hearings are being rescheduled with little to no notice. And our staff is really constantly reevaluating active cases and advising community members every single time there's a policy change that comes down. And also this hostility has bred fear. As you know, many of you have probably experienced, all right? Folks are terrified to leave their homes. Even people who have green cards, who maybe are naturalized citizens, are coming to us, asking us to evaluate their risk of being deported. And I will say, the economic crisis is also compounding this, right? Food and housing insecurity make it incredibly difficult for a family to fight deportation, right? When they're worrying about how they're going to feed their children. So it's fundamental for our work that those services continue. And one other thing I'll say is, like other service providers, our funding is under pressure. Federal funding for this work has largely vanished. State funding is somewhat at risk. Also, because of the way that state funding is allocated for immigration services, it's done regionally. And the Bay Area is assumed to be universally well-resourced, even though we know that a lot of those resources are concentrated in places like San Francisco, and many of our communities, especially in South County, unincorporated areas, are deeply under-resourced. So, to continue protecting our communities, we really have 3 priorities. So one is sustained funding for immigration services. We're so grateful to the county and particularly to Supervisor Bas for championing funding for Asila, Acudir, and Accord. And we really urge the county to continue stable multi-year funding for those collaboratives because the safety net is really what is going to help keep Alameda County families together. Another priority for us is establishing a county office of immigrant affairs. Most other Bay Area counties already have this, and we really need a centralized long-term county investment to coordinate all of the immigration work. And I think it will also streamline resources and maximize efficiency in a way that will save the county effort and hopefully dollars in the future. And then the last thing that I want to mention is keeping ICE out of Dublin. So many of you may have heard that there is a former federal women's prison, FCI Dublin, in Dublin, that was shut down after survivors of sexual abuse by staff there came forward. And we know from recent environmental reviews that the facility is literally toxic. It's riddled with asbestos and mold. It was formerly a munitions testing site for the federal government. Yet the federal government right now is moving to potentially repurpose the site into the largest immigration detention center in the Bay Area. And we really appreciate the county for putting forward a resolution condemning that. And we really need to continue putting resources into educating the community. Many folks still don't know about that, and continuing to organize to keep that facility permanently closed. So, and the last thing I'll say is, I know it's a time of budget cuts and there's so many priorities. But for me, this work, it's not just a moral imperative, it's also an economic investment, right, in the stability of the county. When we're talking about a county that's 1/3 immigrant, right, keeping parents in their homes, keeping workers in their jobs, right, keeping children in their schools, that impacts all of us. So again, just want to thank Supervisor Bas and everyone in her office for their leadership and their partnership in this work. And I'll say, if you want to learn more about the collaborative, you can visit our website, ccijustice.org. Thank you.
Thank you so much, Lisa. The work that you do together with all of our coalitions and our public defender's office is so important to protect our immigrant and refugee community. I actually was accompanying an individual and their family recently to their immigration hearing, check-in, and got a chance to see firsthand what a difference it makes to have a lawyer. So all of these issues that we've talked about are interconnected. Having due process so that your rights are honored and respected, healthcare, mental health care, housing and food. All of these are fundamental basic rights that we need access to, and the county, as our social safety net, can help provide those resources. So next, we want to go through our budget process and give you a sense of what's going to happen and how you can get involved. So for Alameda County, we have values around transparency and accountability. That's really important to me as an elected official. We are stewards of our public resources and our social safety net, and it's important to ensure that our board, Alameda County stakeholders, and members of the public receive timely information and have ample opportunity to meaningfully participate in our annual budget process. And last year, my first year in office, with our collective advocacy, we were able to push to receive the proposed budget from our county administrator 2 weeks earlier. And so that gives us a little bit more time to review and analyze the budget. So you'll see here some of the dates in our budget process that we've already hit. One of the next key dates for community feedback is coming up very soon. So June 18th is when we'll open our budget hearing. And then very importantly, on June 22nd, we'll have a public budget hearing with public comment. That's the day where the board really listens to the community. June 23rd will be board deliberation, and then June 25th is when the areas where we have agreement will get incorporated into the budget, and we will adopt our budget, which will be balanced. So there are additional opportunities to engage. You know, these organizations and coalitions were invited, and there were other ones in April that were invited because they're doing very important work that needs your support and advocacy. Coalitions and organizations that do issue-focused organizing and advocacy really show that there's strength in numbers, and being a part of a group or coalition really does make a difference in terms of us as board members, knowing that those comments represent the voices of many, many more people than any individual that we might be hearing from. So please get involved with organizations and coalitions. Participate in the electoral process at every level, come to our board meetings, send us public comments. I do want to note that I asked our board to officially support the billionaires tax, which we voted to do, and they were able to gather enough signatures to place that measure on the November ballot. So you will see that on your ballot in November, and on my volunteer time, I will be working to support that measure, because we really have to make sure that everyone in our state, whether it's a wealthy individual or a corporation, pays their fair share, and that our tax structure is more equitable to make sure that people's basic needs are met. So advocate with your state elected officials as well. There's important work that the state can do around both budget and policy to support our healthcare system, to continue funding homelessness services, and to make sure that our tax system, again, is more equitable. I think the next slide has a little bit more information. Thank you. So again, we'll share these slides with you. We have our proposed budget online on the board's or the administrator's budget website. There's a district map on my website so you can see who your supervisor is. You can feel free to reach out to us, join our upcoming board meetings, and again, participate in elections and support state advocacy so that all of your elected officials know what you care about. Finally, we want to make sure that we answer a few of your questions. So thank you to my Chief of Staff, Dave Brown, who's been answering questions in the Q&A. I want to introduce you to and invite up Brianna Brown, who is our Director of Community Engagement. And she is going to read a few of the questions that we have received.
Hi, everybody. Good afternoon. My name is Brianna Brown, the Director of Community Engagement for Supervisor Bas's office. One of the questions that we received, Supervisor, is how can community-based organizations and nonprofits get funding from the county?
Thank you for that question, Brianna. So the county does have a set of values, which includes many of the topics that you heard about. In addition, I want to note we had one of our representatives on the Reparations Commission and want to lift up that equity is also something that guides our county and something that me and my office are very committed to. And within that structure of our vision, our 10-year vision, and looking at racial and other types of equity, the county does use a competitive RFP procurement process that's run by our county departments. And so you might remember when Agnes was presenting on our budget, we have a number of contracts with community-based organizations through Alameda County Health, as well as social services, our behavioral health department. So those departments have various lists that you can subscribe to and learn more about their requests for proposals and how to apply for funding, as well as exactly what those guidelines are. If you reach out to our office, we can make sure you're connected to those distribution lists. And as Agnes shared earlier, community-based organization contracts for the next fiscal year are on the county's budget website, so you can see what those are.
Thank you. The next question, what is the timeline for releasing more Measure W homelessness funds? Specifically, are those funds to build new affordable housing, shallow subsidies, shared housing, housing for seniors, and housing preservation?
Thank you for that question. Measure W, again, is our half-cent sales tax. And the board, together with all of the advocacy we did together, including the town halls that some of you participated in, the board has allocated 80% of those funds for Measure W to our Home Together plan to address homelessness and 20% to essential county services. So regarding our Home Together fund and using Measure W to implement it, we've allocated $116 million so far. And that includes for rental assistance, like a flexible pool for rental assistance, expanded services for our housing resource centers, nearly 300 additional shelter beds, and 950 new affordable housing units. And some of you may have heard that our point-in-time count, our homeless point-in-time count results were recently published, and that point-in-time count, which happened in January earlier this year, showed that fewer people are experiencing homelessness. Certainly, there are too many people who are unhoused. However, our investments did help to show that there is a 13% drop in the number of people experiencing homelessness since 2024, and the number of people who were unsheltered has decreased by 18%. So we do need to keep moving forward those investments, especially the ones that work. Measure W, like the RFPs, the request for proposals I talked about earlier, is a competitive process. So those funds are allocated based on a request for proposals process that our health departments, homelessness and housing division administers. And we can share with you their email and website so you can be in touch with them. There will be more RFPs later this year, as well as presentations to our board so that we can fund shelters. That request for proposals is coming this summer. There will be a second round of capital funding which will allow for new affordable housing units for people who are unhoused. We'll also have requests for proposals later this year for homelessness prevention and workforce development. So again, at our housing and homelessness website, you can sign up for emails about those opportunities. And lastly, again, Home Together is our county-wide plan to address homelessness. We are updating that plan, but it does contain the specific priorities that we are funding with Measure W. And there will be opportunities for community input and engagement as that draft plan is presented to the broader community and to the board.
And I think we have time for 2 more questions.
Okay.
We received several questions about how the county funds variation programs and services and whether there are funding opportunities for initiatives like arts, culture, youth programs, small businesses, and services for seniors.
Thank you for that question. I mean, certainly all of those things are really important to having a thriving community. So I do want to kind of go back to the county's mission. So the core responsibility of the county is to provide safety net services for vulnerable populations. And especially in times like this one, where the federal administration is not investing in those safety net services, the bulk of what the county's investments are in our budget goes towards protecting those vulnerable communities. There are robust community investments and programs that support seniors and youth. So I'll go through a few of them. For seniors, we've earmarked funds for seniors through our Agency for Aging. We also know that seniors are the fastest growing population of people who are experiencing homelessness, and our investments in affordable housing and homelessness services prioritize people with high medical needs, including seniors. In regards to youth and transitional age youth, I'm very passionate about supporting young people, especially TAY or transitional age youth. And there's specific projects that I'm personally advocating for funding for at every level, including at the state level. Here at the county, we are targeting funding for children, young people, and transitional age youth. That includes foster care funding, so supplemental funding to help young people transition out of foster care. In terms of mental health, our Behavioral Health Services Act has a set aside for services for children as well as transitional age youth. And then we have another sales tax, which is called Measure C. And that sales tax measure is for childcare providers, including vouchers for childcare. It also funds programs for children's health. And we were able to fund shelters for children and families who are unhoused through Measure C very recently. To hear more about Measure C, you can go to First 5 of Alameda County. Beyond these safety net services, the county does provide some grants for small business support, including in the unincorporated areas. And then in terms of arts and culture, through our County Arts Commission, we have an annual grants program, and we are always looking for ways to collaborate with our Arts Commission to really expand our investment in arts and culture. So again, really encourage people to get engaged, to reach out to myself and our staff so that we can figure out how to partner together. But certainly I appreciate that question, because during this time, arts and culture is a form of joy as well as a form of resistance.
And before you close us out, our last question is, what time of the board meetings on June 18th and the 22nd?
That is an excellent question. So one of the basic things you should know about how we function at the board is we have 3-day noticing of agendas, which doesn't give you a whole lot of time. And then for special meetings, only 24 hours noticing. It's very different from when I was the president of the Oakland City Council, where we had something called the Sunshine Act, which provided for 10 days noticing. So I do encourage people to follow me on social media. Every weekend, I share what's coming to the board and specific days and times, as well as agenda items you might be interested in. So on June 18th, when we open the budget hearing, based on what I know, we are likely having our budget hearing open at 1 p.m. on Thursday, the 18th, and that will be following our regularly scheduled planning meeting. And then Monday, June 22nd is when we expect to have our full budget hearings. We usually have those type of meetings at 9:30 or 10. So again, because we have 3 days noticing, I can't tell you today what time those meetings will be, but please do follow us on social media. And we can follow up with you as well to share the website for our board meetings. Okay. So before we close out, thank you again to all of our community partners who shared the amazing work that they are doing, as well as their advocacy. I'm really proud that we are partnering with all of you and happy to be supporting your advocacy efforts and objectives. I do want to thank my staff, including the staff that you had an opportunity to meet. Agnes, Aliza, Cynthia, and Brianna. Thank you again to Dave, who was answering questions in the Q&A. And also welcome to Savannah, who is our newest staff member. She is our new office and communications manager. So as we shared at the top of the meeting, we will email you because you registered to get the Zoom link. We'll email you with information, including the video recordings from this session and the April one, the slides, and information on our board meeting schedule. And again, please make sure you connect with us through email, social media, and coming to our board meetings. Thank you again for engaging. We look forward to continuing to partner with you.